Hi, my name is Ruben Gobisi, and I'm one of your colleagues, an orthopedic surgeon and a physician. And I'm going to demonstrate how I discuss PTG with a patient. And we're going to walk through over the next few segments. We're going to walk through what it looks like to integrate a digital therapy platform in your practice. Let's go. Mr. Olson, how are you?
Hi.
Nice to see you again.
Thanks.
Okay, so Mr. Olson, you understand a bank cart repair?
Mm-hmm.
You understand that you've had the instability, and we've gone over through the rehab process and how we're going to educate you, bring you in for your pre-op. You're going to start you on your digital health program and physical therapy.
Yeah.
So in our practice, we use what's called a hybrid model. We use both digital therapy and physical manual therapy. So that means you're going to come to the office once a week, get some physical therapy with one of the therapists or a therapist near your area. And then every day when you're not in a therapy office, so let's say you go once or twice a week, that means there's 5 more days in the week. I'm going to give you an app that you're going to download on your smart device, whether you have an iPhone or your Android. And basically you're going to get pushed exercises every day. You're going to do those exercises every day. The therapy is not difficult, you just have to do it. And I'm going to give you the tools to do it correctly. Okay? Well, my care team, I have an athletic trainer who's going to follow you every day on your home program, and then my therapist is going to interact with you once or twice a week for 10 minutes. That therapist is going to review your progress and either speed it up if you're doing really well, slow it down if you're a little slow, or add or adapt exercises as needed, okay, based on whatever else is going on with you. And then I'll see you at our normal post-op intervals, and you'll be able to see every day what I want you to do and how you're supposed to be doing relative to what you're actually doing, and hopefully those are the same. And like I said, it really allows us to, if you travel, you can take it with you. It doesn't matter, but just do the exercise, and I think you'll be a lot happier.
That's great.
This is a handout we give you just to sort of have you peruse that, and then my team will reach out to you and make a phone call with you and get you on the platform and so on. The QR codes are here, so you can just download the app, and then my team will send you an email that basically gives you the ability to access the app, and you can go from there.
Awesome.
Okay?
Thank you.
You're welcome. Good to see you.
Good to see you too.
Okay, we'll see you at the surgery.
Awesome.
So in the workflow pathway that you've seen in the slide decks, you see that we have a scheduler, an athletic trainer, and a physical therapist. Kiara is my scheduler.
Hello.
And Kiara's job is to reach out to each of the patients, whether she pulls them off my OR schedule or pulls them off emails from the therapist when they see therapists that aren't part of my practice, but they come into our therapy program. They can refer them to Kiara. Kiara's job will then be to take their information off of the EMR and reach out to them, enroll them into the platform, give them a username and password, in other words, make sure they know which QR code to use to download the app onto their smart device, and make sure that they know how to use that. So, Kiara, any comments on that?
Sure. I mean, it's super easy to do. Actually, I just, like I said, like Dr. Beasy said, I just take their information, give them a call. I walk them through the registration process, which includes downloading the app. I help them to get logged in, and then I set them up with their initial visits. It's pretty easy.
On the workflow sheet, you see that Kiara said a very good point. She registers them, and then she schedules them. Her job is to schedule them with the athletic trainer for the remote patient monitoring program, the home exercise program, and then with a therapist, virtual therapist from our practice, and that's whether they're going out to wherever they live. Most of our patients don't come from around here, but if they go out to a therapy center where they live, they can still get connected with our therapist who knows our protocols once a week for 10 minutes. It's a 1-unit visit, and Kiara arranged that, and then off to the races we go.
Yeah. So
as you can see, this is our outpatient physical therapy wing here at our hospital, and basically we're going to go in here and check out real time how the therapist uses the PTG in the office to go over the program and plan of care with the patient. And so they come here, they do the regular manual therapy, and then they go home. So here we are when the patient is working diligently on a non-operative case for a fracture and rehab. So Shilpa is working with the patient and has the plan of care up so that they can go through and make sure the exercises are being followed properly and can add and adjust the plan of care as needed. So that connects the digital platform at home for the home exercise program with the in-office manual therapy, and ultimately back to the office, because with the dashboard, your staff is going to be able to see it. So as a physician, I really don't ever really log into PTG. Instead, my MAs and my staff have the PTG dashboard up for each of my patients when I come in at their post-op visits. That allows me to really see in a snapshot how somebody's really doing. And I go from room to room to room to room. You'll see now. Well, hi there, Marion. How are you?
Good, how are you?
Nice to see you. I see that you're about 6 weeks out from a biceps tenodesis.
Yes,
Great. How's it coming along?
it's been going great.
Let me see you raise it. Okay, good. Raise it all the way up, all the way up. There you go. Great. Okay. And here I see you've been doing your therapy.
Yes,
Great. And you're doing green, and the dashboard looks really good. Very compliant. Good job. And how have the interactions been with the athletic trainer and the therapist? They've been
it's been great. They've been able to help me too.
good. You feel like you understand what's going on?
Yes, very simple, very easy to understand.
Put it here, girl. We'll see you in 6 weeks.
All right, thank you.